thank you for coming. Thank you to Terran and Andrew for letting me come out and join you guys. My name's Evan. I'm a physical therapist and a strength coach. I've been a PT for about 6 years, and we work at a clinic in Rogers called Specialized Physical Therapy, which, our specialty really is strength training for people of all walks of life. So we do a lot of barbell training at our clinic. We have a bunch of racks and platforms. A lot of people that have never touched a barbell join us, and during the course of their rehab, if it's appropriate, that is kind of the centerpiece of their recovery. And a lot of the time we find they get much more out of their PT than the traditional approach. We do both, but we see that benefits a lot of people. And that's people from all walks, and people that are able-bodied, people that have limb loss, all those. So there's not a lot I'm going to talk to you about tonight, but I have a couple points for you guys to consider. I'm guessing most of you have had your prosthetics for some time, and it's not super new, because that varies. That changes your timeline for strength training and how you approach that. Just to improve your mobility, your ability to get back to what you love. There's really three things that we care about, just big picture, and that's improving your strength, improving your mobility, and improving your balance. And when we talk about mobility, we think about can you bend your knee that far? Do you have the flexibility to sit in that position? But really mobility is strength applied to that flexibility. So can you control your body through that range of motion? And then balance really is applying strength to coordinated movement. Are you strong enough to keep yourself in balance? And with a prosthetic limb, that becomes a big challenge. So really the centerpiece of those three is strength, which is really just force production against some external resistance. And that's a simple process of just overloading your body and challenging it to make it get stronger and adapt to a greater amount of stress or work. And as it gets better and better at that, you gain more function with your everyday mobility and whatever goals are important to you. So there's a few changes to consider in terms of, after an amputation. There's changes to muscle function in a number of ways. The muscle atrophy that occurs just during the normal healing process. Some muscles are totally removed. Infection and other things can affect that process too, recovery. The length of muscles are changing, so muscles that are intact sometimes are reattached in different spots, and so they still perform a function, but they're not performing the same function or not as well. And those are all considerations we have to think about with strength training amputees. So biomechanics, or really just the physics of how your joints move and function as a whole system, that really depends on where the origin and insertion, the attachment points of the muscles are, and then what the leverage is of that muscle is. So my quad, because I have a kneecap that lifts my quad tendon up away from the knee, I have a lot of leverage to straighten my knee. But if that shifts it off, I'm missing part of that patella, that kneecap, or if the muscle insertion changes or loses part of its length or a portion of the muscle belly, then its leverage and its biomechanics will be shifted. So that has to be taken into account when we're trying to get somebody to adapt and get stronger. You're going to lose some proprioception, obviously, with the loss of the limb, and so your awareness of body position, which is what proprioception is, you can overcome that by improving proprioception in other ways and gaining strength and stability in other ways, but that's a process of neurologic change that has to occur too. And then there's compensatory movements. Your gait, your stride, the way that you walk is going to be different with a prosthetic limb. And energy efficiency is a big deal with that, because when you're able-bodied and have an intact limb and you walk with a certain amount of energy efficiency, and you compare that to now you've recovered and you have your prosthetic and you're walking independently, you're expending 25 to 100% more energy with stride than you were before, depending on what portion of leg loss you have or things like that. And then finally, impaired circulation matters too during the limb shaping period and everything. The vasculature that feeds the muscles with blood and oxygen and nutrients to grow and adapt, that is shifting. That's a shifting landscape. And so that impacts your ability to strength train. Somebody who's recovering from an amputation and has an intact muscle there that we're going to try to target to strengthen is not going to get strong as quickly on the same muscle group as somebody who is intact because of the changes in circulation and swelling and everything else too. So there's really kind of 5 phases, and this may or may not line up with kind of you guys' philosophy. You deal with this every day. We just deal with it some with patients, and so let me know if you find anything to be different in your kind of day-to-day. But We break down the phases of limb loss and recovery in terms of their relationship to when we start strength training in earnest. Then there's really those 5 phases. And the first one is acute post-amputation, and that's the first few days to weeks after. The goal there really is just to protect that surgical site and to protect the healing tissue. After phase 1, where you're not really doing a lot of strength training, you're really just trying to protect the surgical site and begin the process of healing safely. We're not really working with you that much in the PT clinic. In phase 2, the early prosthetic fitting, you're getting that temporary prosthetic, you're starting the limb shaping process, you're wearing your sleeves and fitters and everything else. Really, we're trying to just regain mobility to be able to move that limb in and out of different positions, monitor the healing process, and then shape the limb for fitting for that final prosthetic. So early strengthening is going to happen there, and your prosthetist or your physical therapist will give you exercises that will help with that, or references or resources. A lot of that's pretty basic. It's things like learning how to get in and out of bed and in and out of a chair on your own, now that you're working with less equipment. And that process includes strengthening, but it's a different kind of strengthening that we'll talk about in a second. It's really this micro strengthening approach of like targeting muscle groups, targeting specific functions, and then building up from there. That differs from macro strengthening, which is really just getting your whole body to improve how it works as a system to produce more force. We'll talk about that in a sec. But phase 3 is healing and adaptation, and that's months long. You've really recovered from the amputation, the limb is taking shape, and you're going to be able to support the prosthetic that you're going to have long term. Now we can really start in earnest with that more macro or compound strength training. Healing rates and complicating factors vary so widely. Everybody's story is very unique. But that's the point at which we can really start working with people. And in my outpatient setting, we see them a lot more. I used to work at Washington Regional in inpatient rehab, so we would work with amputees there. And with them, we're really dealing with those first 3 phases. So our strengthening goals and our structure for rehab is very different than what I do now, where I get somebody who's pretty able-bodied now with their prosthetic, and they are pretty capable. And so now we're just helping them to improve that or get specific goals defined and worked towards, which I love doing. Those are my favorite people to work with because you can really make a difference for them, and it's so cool to see them on that journey of getting their life back and getting function back. And then you have customized rehab and ongoing maintenance and progression, and that's long-term, years long. And that includes a multifaceted approach. You need a multidisciplinary approach. You have a team of prosthetists and physical therapists and doctors and surgeons and everybody whose primary goal is to get you where you need to go. So we're involved in that process too. Your goals will define your training plan, and the longer that you're training and the longer you're going down this journey, the more your goals will be specific to you. Everybody's trying to heal and just get mobility and get a little stronger at first, but what you want to get back to depends on the person, and that's where we really get individualized with our care. So one person, their big goal for the next 6 months may just be able to get back to transferring in and out of the car independently, being able to drive, whether that's with adaptive driving equipment or if they have a right foot that's intact, and so they just need to be able to get in and out of the car and be safe with that. For them, their goal is going to be just regaining mobility with those related transfer positions. It's going to be improving the basic strength and movement patterns to do that activity. And we'll worry about core strength and balance and sitting and all those things too, but that person's plan is going to look a little different than somebody who wants to be able to walk a half mile so they can join their family for that evening walk they used to go on. I looked up the average length that a person with a lower limb amputation can walk after they've undergone those first few phases of rehab. I think that average was I can't remember if it was meters or feet, but I think it was 60 feet or 80 feet or something like that. Does that track with what you're familiar with, Terran?
I haven't heard statistics, but I can see where that would be.
I might have actually write it down here. 220 feet was the median walking distance for lower limb amputees after recovery and adaptation to a prosthetic. That was from a few different research studies that delved into gait after regaining function. 220 feet is not very far, and so if your goal is to be able to go longer than that, there's a lot of things we have to look at. We care about your mobility and balance for independent gait. We care about your cardiovascular endurance. It can be hard to improve your cardiovascular endurance beyond the baseline when the limiting factor is not what your heart can do, so it's hard to challenge that. It's what that leg and muscle in the leg can do. So we have to have an approach that deals with both of those things and helps mesh them together. And we need to increase maximal strength to meet energy efficiency demands. So what that means is if you take someone who can pick up a 100-pound weight off the floor and stand up with it, whether they have a prosthetic or they're intact on both legs or not, either person in any circumstance, if you take that person and now they can pick up 200 pounds with whatever adaptive equipment or whatever else, they have gotten a lot stronger. And because their maximal strength performance, their force production capacity has gone so much higher, now their walking and other everyday tasks have become much more sub-maximal and much more easy by comparison. So if your goal is to walk longer distances, then we need to get you learning how to do some kind of adaptive deadlift or pulling exercise that uses all those muscles that will carry over directly to your function. So those two different examples, they're going to look very similar at first in rehab, but the longer they go, they're going to look very different in the interventions that we use and focus on. So we kind of talked about this earlier, training micro versus macro. Micro training, which this isn't based in anything, I just kind of made this terminology up, but micro training is really just those independent, simple exercises that oftentimes can be done easily at home. Once you understand the process, you've been educated, and you know what you're about. The traditional PT approach kind of stops there a lot of the time. Historically, we've been kind of bad about saying, well, here's some bedside tabletop exercises that we'll have you do 3 days a week in the clinic with us, and we'll do that for 6 weeks or until you get tired of us, and then you'll be on your merry way. But the amount of function you regain from that is often pretty limited. In some circumstances, that's totally appropriate, but a lot of the time we can do a lot more for that person. So I usually outsource that to somebody to do at home, and within 1 or 2 visits of me working with them, they're totally independent with that stuff because it's simple, and they understand, like, here's the list, here's how many sets and reps and how often to do it, but it's your job to figure out, like, how to make this challenging enough to be kind of that regular movement practice to be effective. And I tell them that's the mortar in the wall or the building that we're trying to build up, and the bricks are going to be the strength training and other specific things that we do in PT. And the two together are going to support this structure we're trying to build up in you. Then macro training, practice is obviously really important with that. Practice with certain mobility tasks that you can practice all the time throughout the day at home or wherever else. And a good PT is going to be able to show you how to do that process too. Macro training really has more to do with a structured plan with benchmarks for strength, like I was talking about with the deadlift, right? Which is sounds impossible for a lot of people that have undergone limb loss. But we're going to look at some examples in a second of people that do amazing things as adaptive athletes, and I'm sure you guys have seen some of that before too. But in a PT setting, we can do that with people. We can help them to really do much more than they thought they were capable of. Not everybody needs to do both of those over the long term. A lot of people, this micro thing is fine. They can get function back and be happy. But for the people that want to do more, or they have a higher function goal than the other person, we can help them with that. And most of the time, you're really going to need to work with a professional or a group of different professionals who can help you get there. Here's a couple examples. All of these are different pulling exercises. There's other lifts and athletic events that adaptive athletes are doing with similar focuses, but these are 3 pretty cool examples, but they're all different. So the top right, he's using a sling and a brace to perform a deadlift, which is really just a really good expression of full body strength. It's, can you pull up on the bar and push on the floor until you are at standing? And you're using from your toes to your eyelids, you're tensing every muscle when you're pulling a really heavy deadlift. And this guy is missing his left arm, and so he has a strap that actually supports the bar. It changes the biomechanics of the lift a bit, and so there's compensations and things he has to consider, but that allows him to be a very strong athlete. The gentleman in the middle, at the bottom, actually has a strap under his below the elbow amputation that he can sort of hook that residual limb around and perform a clean, which is a pull that turns into a jump and then catching it on the shoulders, which is pretty incredible that he can do that with 1 arm or with 1.5 arms and able to pull up on the bar and transmit enough force and power and explosiveness to rack a bar in that position. What that guy's going to be able to do in terms of everyday function with that residual limb or any prosthetic that he gets fitted to that, it's going to be radically different than someone who's not that capable. And then this guy on the left, in the resources I'm going to give you guys at the end, There's a long form video that this guy does that's an interview. He's a strength coach in, I think, Columbus, Ohio. His name's Bruce Trout. I met him at a seminar once, but he was a strength coach before his amputation. But he was in a car accident, lost his leg, was really lucky to be alive, but is still training now as a strength coach and really has taken off. He just got certified into a pretty prestigious coaching position, and he's helped a ton of people. He just has a really inspiring story. So you'll have that link if you're ever interested in listening to him talk. It's really cool. Before we get to that little handout, do you guys have any questions on any of that?
What would you suggest after getting a fitting? First, kind of maybe first few weeks of PT with your new prosthetic, they're getting used to it.
Yeah.
What kind of training are you going to do at that point?
Are you talking about like their temporary prosthetic? While they're waiting for
Yeah.
shipping and everything else to finish?
Basically the
Yeah.
temporary.
So that's kind of that phase 2, early phase 3, right? Where we're in early fitting, and so our goals are not to do the stuff at the end that we're looking at, obviously. We're not going to teach you to deadlift with a temporary prosthetic when that can affect the shaping of the limb and things. We're really going to work more on the micro scale. So these exercises here, let me find that little resource. Hold up. Actually, I'm not sure if I have internet, so I may not be able to pull that up.
We can get you internet. Get a password.
Somebody's living room Wi-Fi is available,
Yeah, pretty good.
and it's unprotected too.
That's some powerful internet.
It sounds like a trap.
So while we're waiting on that, with that is with the beginning part. What if we're going maybe 2 years after we've gotten good
Yeah.
enough to walk up to a couple miles?
Yeah.
What do you suggest at that point?
It's the Wi-Fi and it's the password.
They always do a weird.
Yeah.
At least yours is like phonetic, not just a bunch of numbers.
Mhm.
Let's try that. Thank you very much. Your second question, Andrew.
Yeah, so after those 2 years,
Yeah.
they can
They're
walk
high
a few
functioning
miles. Yeah.
What do we do with that person? Well, yeah, those higher level goals are going to dictate new changes in training. So that's somebody who probably can't. They may have never touched a barbell before, but we may teach them to be an adaptive athlete, really. And they're an athlete not for a sport, but for the sport of life. And so getting them stronger at deadlift, getting them stronger at other things. Usually with a below the knee, or especially with an above the knee amputation, they're not going to be performing much of any squat. But there's other leg exercise and things that are pretty high level that we'll teach them too. That person with that higher function goal that's really returning to an amazing level of sport or participation, yeah, they're going to have a lot longer rehab journey. They're probably going to need to work with somebody like me for a while longer because they're trying to get a lot further in their mobility. When I was in Oklahoma City, which is where I'm from, we got to work with some patients who were clients of Martin Bionics, which they have something called a socketless socket. Some of you may have heard of that. But basically, it allows a lot of them to do some pretty amazing things in terms of mobility and flexibility. There are runners and marathon runners, people using specific prosthetics designed for that. And so, they're going to work more towards improving their strength, improving their aerobic capacity much higher than somebody who is in your first example. They have that temporary prosthetic, we're still shaping the limb, we're doing all that, and just trying to monitor healing. That person's going to do more of the basic stuff. So, I just stole this straight up from some prosthetics company's site because they had a better PDF than what I could put together. But these are those basic bed exercises. And everybody in here that has been, looks like, with a prosthetic limb for some time is going to be familiar with those, right? You did those in a hospital probably with your PT and inpatient rehab or in the acute setting. And then you scale that to things like little chair squats or sit to stands with the one leg and some arm help, and learning how to transfer on your own. And then that scales up to specific isolated exercises and movements that get you moving certain directions and just gain motion. But once you have that, then we can really build out. Once you've gotten the limb shaped and you're on a long-term prosthetic, and you're safe to do it because the residual limb is intact now, and it's fully closed over, there's no pressure issues or anything like that, that person can start to adapt that limb to load bearing, to picking up heavy weights. And because they can pick up heavy weights and bear that heavy load through the prosthetic and through the rest of their joints, their body can adapt to a systemic stress that gets them much stronger. And that's going to bear a much higher yield in terms of function and performance. But what I always come back to, because I walk in both of those worlds, somebody who really is just trying to get like on and off the toilet on their own, and then somebody who's like, I'm gonna go, participate in a 5K jog with my family. Like, both of those amputees have very different goals, and so the rehab needs to look different. And that's where having a professional that can really be personalized and individualized is so critical. Yeah, good question. Any other questions? I've got this QR code. If you scan that with your camera on your phone, it'll bring up really just a short Google Doc that has a couple links on it, but those links include that interview with Bruce Stroud I talked about, some other like video documentaries and things like that that talk about higher level performance. And it actually has that link to those basic exercises too, which, looking around the room, I don't think anybody's going to benefit much from those, because you probably did those for the first 6 months of your amputation, and now that's child's play to you. So maybe a lot of you are in that in-between where maybe you have some work to get some mobility or some balance or coordination to improve enough to be able to do some more high-level stuff, if that's a goal for you. And having a good PT and prosthetist and dynamic team like that can really help you get there. So I'll leave that up as we're kind of hanging out. Anybody's welcome to scan it. And I'll probably post this video too. I may cut it in and out since we had some starts and stops, but yeah, if you guys want to look back at that later, share it with friends that are also going through this too, then yeah, feel free to.